Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. We have a guest that's coming back by popular demand, Elsa Unenge. She is a breathing expert out in California. And Elsa, I want to welcome you. Thanks for being here with us again.
Thanks for having me back, Hal.
So the last time we just kind of talked about all things breath work. I want to concentrate a little bit more this time first on women's health, and then we're going to transition into how breathing can help with anxiety. So Elsa, as we talked earlier, we have a lot of patients, young women, middle-aged women that are pregnant. We do have a lot of the women we see are, in their 30s and approaching 40 and decided to have children a little bit later on in life. So they want to do everything they can to have their newborn to be as healthy as possible when it's born. So maybe shed a little bit of light on how important breathing it is, especially for women and especially for pregnant women.
Mm. Yeah, I mean, breathing is really one of the key things to regulate your nervous system. And if your breathing is off, you're breathing quite up in your chest and shallow, maybe even through the mouth, then you are creating more stress on your nervous system. And when you are more stressed, different bodily functions doesn't work as well. So same when you're pregnant, if you are breathing in a dysfunctional pattern, which is pretty common actually, you turn off different bodily functions that otherwise help your pregnancy. And there is a very large study that was done here in America that you also read. You sent it to me actually, where they looked at 8 million births. And they saw that people or women who had sleep obstructive, or sorry, they had or they had breathing issues while they were sleeping,
Mm.
they saw an increase in so many different things. They saw an increase in blood pressure. They saw an increase in risk of death during pregnancy and also when they gave birth. They saw an increase in, I think, diabetics or diabetes, and then C-section. They saw, yeah, an increase in the risk of issues with the pregnancy if they had sleeping issue or if they had breathing issues during sleep.
Yeah, so
Mm.
when obviously I'm not a woman, but I know I've got five sisters and two children, so I know that when women are pregnant, just all other things being equal, it's more difficult to sleep because of the extra weight and everything. So it would be, would think that it would be very, pregnant women would be very um, affected by if they already have a breathing disorder or a sleep disorder when they're pregnant. That's even going to make that worse. And um, purposeful breathing, where everybody breathes. So I want to make sure people understand we're talking about purposeful breathing, breathing the correct way, and breathing with intent, breathing with intention, because you can breathe for energy, you can breathe for relaxation. Um, Maybe go into that a little bit. If we have, pregnant woman that she's real anxious and she needs to calm down, or maybe she feels really fatigued and she, wants to have more energy without drinking caffeine and doing a lot of things like that, which pregnant women normally don't do because that they're told not to. So, how can breathing regulate anxiety in pregnant women, and also, on the other hand, give them energy and give them that little pep that they need maybe to get through the day at different times of the day?
Yeah, so If you're not pregnant, you can do slow breathing if you want to calm down, and then you can do faster breathing or even stronger breath holds if you want to create that extra push of energy. But when it comes to pregnant women, we recommend or we don't recommend to do the fast breathing or the breath holds because it's just you're in such a careful situation. You don't want to disrupt anything and you don't want to take any risks. So my suggestion, if you are pregnant and you need that extra energy, would be to instead take a break and do the down regulating breathing so that you get some rest so that you then can come into and have more energy. So instead of like breathing to just upregulate with the breath, with the upregulating breath work, I would instead do down regulating breathing to get the rest to then have the energy. So you can, when you're pregnant, you should only focus on slow nostril breathing. So no breath holds, no fast breathing, nothing specific, nothing weird about your breath. So just take a very gentle, slow breaths in and out of your nose. You can, like, for example, breathe in for 4 seconds, breathe out for 8 seconds, or just breathe in a ratio of 1 to 2. So the in breath is like they could be 2 seconds, and then the out breath is 4 seconds, or you can breathe in for 6 and then you breathe out for 12. So just a ratio of 1 to 2. That's a really good one to calm down. You can also do some yoga nidra, which is a mix of visualization, relaxation, and breathing to have that restful recharge to then get your energy. So that's just one simple breath, and I think it's sometimes better to give less so that people actually remember it, because a lot of people come to me and like, yeah, I learned breathing a long time ago, but I don't remember, she said
Mm.
something about this and that. So just think of a ratio, or just think of nose breathing and then that the exhale should be longer than the inhale. So that's a great to give
Keeping
them
it simple,
relaxation.
right?
What's that?
Keeping it simple.
Yes, exactly.
Yeah.
So in and out of the nose, into the belly as much as you can, even though you're pregnant, and then in and long exhale.
Yeah, I think most people breathe too shallow, just where if you don't think about it, I think people breathe too shallow. So they're only using just a very small percentage of their full lung capacity. And that deep breathing really does promote a lot of positive chemical changes in your body, correct?
Hmm. Yeah, exactly. So when you breathe a lot up in your chest, maybe again even through the mouth, maybe your shoulders goes up every time you inhale and goes down every time you exhale, you are signaling to your brain that you might be in danger, because why else would you breathe in this fast shallow breathing rate? Because that's what the brain associates with potential danger. And when we breathe that way, we again turn off bodily functions that are helping us to promote like health in our body. So yeah, that's what can happen if you start to breathe up in your chest and in through the mouth and shallow.
Is there a posture for, especially for pregnant women, and I'm thinking for, maybe a woman in her third trimester, where you really got a lot of extra things going on, extra weight, extra pressure on your organs. Is there any particular posture that you recommend to women to get in when they're breathing, laying down, standing up, sitting? Is there a particular posture that's better than others for pregnant women?
Not that I know of, but I always recommend, if you can, lie down on your back and do the breathing, or sit up. But yeah, whenever they're comfortable. I haven't been pregnant myself, so I don't know. That's why I can't really say. But whatever feels good for that woman, because we're all different. But no, I don't know if there's a specific
Yeah,
posture that is better than the other, to be honest.
yeah. And I don't know if there's been any studies on this. I would like to find out. I've got some resources that I could, but I can't help but think, our children, infants, newborns, infants, toddlers, they really pick up on how their parents are feeling and how their parents act. We see it all the time in our practice. If a parent comes in with a child and we're doing, some orthopedic expansion on children, if the mom or the dad or both are really kind of anxious and it's just kind of wringing their hands, that kind of sounds like the children are too. So I think that if even after a child is born, if the new mother continues breathing exercises, I would think that maybe a good time would be when the child is nursing, because that child's going to pick up on that. That infant's going to pick up on that breathing and that rhythm. Um, and uh, I think that that promotes a very calming effect on
Hmm.
the child as well. Um,
Yeah, I think I don't know if there's a, like a legit study out there, but I think that the child can like we have a connection between humans, even though we can't see it or we can't really explain it. But I think the child can really pick up on if the parent is stressed or calm. And if you breathe, if you practice functional breathing, calming breathing practices, you will, of course, like signal that to the baby and they will also become more calm. That's what I believe, at least.
yeah,
I don't know if it's scientifically proven, but I think there's been a lot of or a few studies on it
yeah.
that shows that
I'm
there's
sure
a
they
real
have.
connection there. Yeah.
We know that children, they pick up, especially children in the womb, pick up on the stress and the chemicals that are running through the mother's body. That doesn't stop when they're born. They still pick up on that. So
Mm.
I think that having that tool that everybody possesses, and that's what people don't realize, that they possess that tool 24/7 in their body to regulate their body through their own breathing. And as crazy as it sounds, it works. I mean, there's a lot of really good books out there on how to do it, but I just from personal experience, I feel like one-on-one coaching, at least at first, is really the very best way to go.
Mm.
And so when you're dealing with your clients and your breathing, you're doing it mainly online, correct?
Mm-hmm. Yeah.
You're online.
Yes, because I
Yeah,
started during COVID, so it was like I was gonna see a
right.
person in a client in person, and then we were like, oh, we should probably do it online. And then
Mm,
I realized, oh, it works as well
yeah,
online. So yeah, most of my clients are online because they're all over the world, so they tune
yeah.
in from wherever they are. And some people are here; they can come over to my house, but we tend to do it online anyways because it's just we can just like wherever you are, you can just press play and
Mm.
we're there.
And I want you to talk a little bit about your practice, and when nearing the end of this our podcast, I'd like to transition into anxiety for men and women.
Mm.
A lot of the patients that we see suffer from anxiety. Some pretty severe, some not so severe, but it's enough of a problem that they're taking medications for it. And our goal for every patient is to, hopefully get them to the point where they can eliminate some of their medications. As airway dentists, if a physician has put them on anti-anxiety, it's certainly not our call to take them off of that. But if we can get someone to start regulate their breathing, um, then they tend to will because a lot of the patients we see, most of them want to get healthy. They don't want to be on medications. So we like to give them tools and guidance on that, and to ultimately go to their physician and say, hey, maybe I can get off the Xanax, or maybe I can get off the different myriads of medications out there. um, do a lot of your clients come to you because they suffer from anxiety and they're looking for solutions, natural solutions?
Yeah. It's the number one feedback that I get from my one-on-one clients, but also those who have taken my courses that I maybe have never met or haven't interacted with, or someone who has done my guided sessions in my breathing library. They reach out to me on Instagram and like they just say how much learning about their breath and knowing how to breathe in different situations has changed the quality of their lives because their anxiety has reduced so much. And they realize that it's their number one tool to regulate your
Mm,
nervous system so that you don't get the anxiety. So, two different ways of breathing for anxiety. One is to improve your breathing so that you breathe more healthy during the day. So again, that you don't have those experience, those times when you have anxiety. And then you have the other part, which is when you do have the anxiety, you can do a specific breath practice that can reduce that anxiety. Because like some people, I don't know, I'm I'm open to like discuss this and hear I don't know what's best, but it's just an interesting thought. Some people are like, no, you just should stay in your emotions. You should feel the heart rate increase. You should feel your breath increase. That could work for some people, but those symptoms are not really healthy for our body. It's not healthy to breathe fast. It's not healthy to have an increased heart rate. It's not healthy to have high blood pressure. So,
Hmm.
if I'm thinking about it, if you could use a tool this time you're breathing, if you could use a tool to reduce all those three things, for example, heart rate, breathing rate, and blood pressure, wouldn't you want to do that to regulate the nervous system to come back to optimal function of all the bodily functions? It's just a thought that I had.
Hmm.
But yeah, and as well it reduce anxiety in the moment when you apply the breathing practices because you are physically changing things in your body when you breathe.
Yeah. I agree with you 100%. I think that if you are having an anxiety attack, if you know you've got the tool, you possess the tools, um, and if done correctly, to mitigate that, or to stop the anxiety attack, why not do it? I mean,
Mm,
yeah, high blood pressure is not, I mean, that's not good for anybody. Maybe an increased heart rate, when you're running and for
mm-hmm,
exercise, that's okay. That's what cardio exercise is all about. But I think that the people that suffer from anxiety, and I guess we all do to a sense, to some extent. um, Anxiety is probably good in some cases, but because it's more of a sympathetic nervous system, fight or flight, et cetera. But I know from personal experience, I someone very close to me that is currently undergoing some really severe anxiety attacks, and this person has suffered with this for decades, and they're in their older, in their 80s now, and it's getting to be a real physical issue with them. And so I would love for them, and I'm actually, after we're done with the podcast, I'll talk to you a little bit about it. But I would love for this loved one of mine to be able to maybe spend some time with you, because I really think that you could help them. But
yeah.
they won't have to do it. I mean, obviously, I think some people think of, oh, breathing. What, we all breathe. Why? How would breathing help me? But I'm I'm here to tell you, and you see it all the time, that it's an amazing tool for health. So if
Mm.
somebody is has suffered from anxiety for years, and I'm sure you've seen these people, um, how quickly can if you have a couple of sessions with them, is that something that they can start immediately and start seeing the effects like that day, that
Mm-hmm.
after
Yeah.
that first
That's a
exercise?
very common question that I get. How fast would you see results and how much do you need to do it? But the simple answer is just if I do a 5 minute breathing practice or just a few breaths with someone, they already feel the effect of calming
Mhm.
their nervous system. Like they take three calming breaths and they feel the shift already. So if you think about it, if you can feel the shift from just three breaths, then imagine how big of an impact it can have if you do 5 to 10 minutes every day, every night before you go to bed. If you do it every night before you go to bed, you have better sleep and then you have better rest and you feel more energized than the next day. So it's just a positive cycle.
Yeah.
So yeah, you and one of my clients, he had severe anxiety, which meant that he couldn't. I always give this example. He couldn't cook dinner because he couldn't chop the tomatoes and boil the pasta at the same time because it was too much for him. So, and he saw a 50% reduction in his anxiety after just 4 weeks of doing my online program. So he didn't even speak to me on a daily or on a weekly basis. So that's pretty huge. And now he's back to normal almost. He's always working with it, but it just has had a tremendous impact on his anxiety. And I get those messages all the time that people are like they think it's too easy to have that big of an effect. They're like, how can just changing the way I breathe impact
Right. Yeah.
my anxiety? But it really does. It really does, and it's not like a burden really that you have to apply breath work because it's you take a minute to relax and feel nice in that moment. And if you don't feel like you have 5 minutes every day for breathing, you apply it to something else that you're doing. You apply it when you're going for a jog. You apply it when you drive to work. You apply it when you walk out of your house. Like you can do it when you do the dishes, for example. So you don't have to spend extra time if you feel like that's why you don't do it. But if you have 5 minutes, it's a very nice thing to just take a moment to pause and feel calm and safe, because that's really the effect of calming breathing, that you feel safe, you feel good.
A lot of people that suffer from anxiety and depression are on sometimes multiple medications. In your experience, I know you're not a physician, but in your experience, have you found that if certain combinations of medicines, I'm not asking for specifics, but people that are on two or three, four medications, does does the breathing exercises and purposeful breathing for health, is it is the effects of the breathing mitigated by all the medications, or will it have the same effect physically on someone that's on a lot of medications versus somebody that's not, and that never got on the medications? Has that been something even you see a difference in your patients that might be on two or three different meds specifically for depression, anxiety, versus somebody that's, hey, I just want to be healthier, I don't want to take any medications, and I'm not on? Do they both respond well to
Mm-hmm. Yeah.
breathing equally?
Yes. Yes, because it's again coming back to the nervous system all the time, but it's regulating your nervous system so that you feel more in control and that you feel more safe and relaxed. And that has an effect on, I think,
Yeah,
everyone who tries breathing, if they try the right breathing technique. Because people are like, oh, I tried box breath and it was so uncomfortable, and some people tried box breath and felt like it was the best thing ever. So
yeah,
it's if they try the practice that works for them. Maybe they did a box breath that was more tailored to men, for example, because men has bigger lungs and bigger airways and bigger diaphragms. So we are different, men and women are different when it comes to breathing. So they might have done a very slow box breath, it might have been too slow for them, and if they would find their perfect ratio, they would feel the calming effect. So if you have tried breath work and you have, instead of feeling calm, you'd feel panic almost from doing it, then you're not starting. That's not the practice for you. That's the thing. Like with breath work, you have to find the practice that works for you. So if you tried
and
it and you feel like it's uncomfortable, try another one. Try a few different. Try different ratios. Again, with the 1 to 2 ratio, maybe yours is in for 2 out for 4. Maybe someone else is in for 5 out for 10.
when you bring up a really good point. When you're working with someone one on one and you're working with them live, um, how do you is it just kind of like trial and error? Nobody's gonna hurt themselves by breathing, but is there a way that you kind of eliminate, hey, maybe this is not the best for you, maybe this, before you even start, like after you've talked to them and found out what their issues are? Do you kind of have in mind that, maybe box breathing is not the best thing for you, maybe we should try this? Do you
Yeah,
have
so
kind of a method that you look for that?
Yeah, so I do a few tests, breathing tests that you can do at home. So I do those tests, and when I do the test, I see roughly where they are. If they are a if they have high CO2 tolerance, then they can hold their breath for longer without feeling the panic. If they have low CO2 tolerance, they can hold for shorter. So I check where they are on that scale, and then I give the different exercises. And then of course they try it out, and I we pause and like, how did that feel for you? Okay, felt good. Okay, let's add 1 more second. Let's make it shorter, like, or let's make it slower, or let's make it faster. So that's how we go about. And then when they do the online course, they try out the different practices and see which one that works for them. And then you can gradually move up to the next practice and then the next practice. So you gradually get used to breathing slower, but you need to start at your pace.
And so, kind of jumping back to our first topic with
Mm.
pregnant women, there are certain breathing exercises with a pregnant woman that you would say avoid. Don't do these right now. And one of them is breath holding. You don't. as a pregnant woman, you wouldn't want to do anything like that, right?
Exactly. So I wouldn't do box breath. I wouldn't,
Yeah,
yeah, I wouldn't do any strong breath holds. I wouldn't do anything that is upregulating, which means just breathing faster than she would normally breathe. So you check in with your normal breath, and I wouldn't suggest anything that is faster than that rate.
yeah. Okay, that's important to know because I do know that I have a few. I've been to James Nestor's breathing retreat, and so I've got a lot of information from that, a lot of audio breath work. Uh, 15 minutes, 20 minutes, 30 minutes, and I'll choose the one that for the time that I have at that time. But on most of them, the breath work coach says before we start, if you're pregnant, this is not for you, especially
Yeah.
the ones with breath holding. Um,
Yes.
that's not recommended. Um,
And that to say, like, this is not black or white. This is not, the science is 100% saying that this will, like, you will have negative benefit or negative results if you do these upregulating and breath holds. It's just to be
to be
safe.
safe, yeah, yeah.
Because I know pregnant women who have done holotropic breathing, which is the most extreme upregulating breathwork practice probably that you can do, and
Mhm.
I think they were perfectly fine. But and I'm guessing they maybe did some breath holds there too. So, it might not be a problem, it might not be an issue, but again, safety first, avoid them if you want.
Yeah, yeah. Well, that's great. Um, Elsa's information to get a hold of her is at the bottom of the screen. I would highly recommend having personalized coaching, whether you do it live with Elsa or whether you choose one of her online courses that you can access at any time. You still have that personal coaching, and while breathing is very safe, you want to be if you're going to spend the time to do it correctly and be coached to do it. Just like if you went to the gym and you're not used to lifting weights and you have a trainer that shows you the proper way to do it so that you don't hurt yourself first of all, and so you get maximum benefits from it.
Mm.
So having a breath coach literally can change your life both physically and mentally and emotionally, and I've experienced that myself, and it's a pleasure for me to be in the same circles as people like Elsa because we're all taking a very holistic approach to health. And I thank God that I live in the United States. If I have stage 4 cancer and need it treated, there's nowhere else I'd rather be. But we've also become very dependent on pharmaceuticals when we have everything that we need in most cases to have a very healthy life and to be able to thrive just with diet, exercise, breathing, and it's people like Elsa that help us along with that. So, Elsa, before we sign off, do you have any parting words of wisdom for our viewers?
Maybe it would be that you don't have to see me for 8 or 4 sessions, or it doesn't have to be like a huge step. It could just be learn 3 things about your breath, because I have these company sessions where people log in and there are thousands of people listening to me, and then I don't obviously hear back from them. They just like sign out. And I've talked about some steps for 45 minutes, and then I hear back from them 6 months later and like, hey, I went to your workshop and I learned so much and I changed this and this and that. Now I'm off my asthma medication. I feel less anxious. So it's just learning something that you can start to implement into your daily routines that will have the difference, or that will make the difference. So it doesn't have to be that huge step. Just learn a few things about your breath, start to change them, tweak them during the day, and they can have, yeah, tremendous effects on your health.
Well, and so for people that like I talked to Elsa about this the last podcast we have, but I haven't followed up on it. We've got a major reconstruction going at our office right now. So our office is I'm not going to say in shambles, but we're living in half the office and practicing in half, and the other half's being remodeled, and that's almost done. Then we're going to start the other half. So it's been kind of crazy. But one thing that we are going to do is we're going to have a breath session or two or three with Elsa and our whole team. So that, how does that work, Elsa? Would we, like, we have a little teaching center where we can all of the employees and team members can fit in there, and we would put you up on a screen like, or like maybe a family would do in their living room. You would be up there and you would be guiding us through various breathing exercises, correct?
Exactly. So you can even gather in the same room, which is quite nice, so that you can then discuss maybe when we hang up, or maybe when we do the questions and answers. You can like talk in between each other in the room,
Yeah.
or you can just dial in from wherever you are, which is the one that I referred to with 1,000 people. They were not all in the same room; they were from all over the U.S. So you can dial in from wherever you are, and then it's usually around half the session is theory, and like you can feel what I'm talking about. You feel the difference between diaphragmatic breathing, chest breathing. You feel the nose breathing versus the mouth breathing, what that does to the body. So it's theory, you're learning about your breath, and then the second part is the practice. So you can practice what you learn and take a few tools with you, and then we'll end with some questions in the end. And that's the most fun part, because that's when people can come with their own personal stories. They maybe are an ultra marathon runner and they are struggling with this and that, or someone has asthma, or they just, yeah, their personal stories.
Are most of those sessions, when you do a group like that, they're 1 hour?
Yes,
Okay.
usually 1 hour, but we can tweak it. It can be 1.5, it can be 30 minutes too.
Okay. So Elsa, I have a study club with doctors all over the country. She's going to be our guest speaker next week, I believe, next
Yeah,
Wednesday.
next Wednesday.
So I'm looking forward to that. And then Elsa, I promise you that we're going to get this with our team, because our teaching center is almost completed, and then we can go in there and have a great work with you. And I would love for all of our team members to experience what both Dr. Corridor and I have experienced with breath work. So
Mm.
we're excited to work with you on that as well.
Yeah,
So
because
it's been a pleasure
you've
today.
seen
And
quite dramatic changes with the breathing, with your high blood pressure. I think we talked about last time.
yes, yeah, yeah. I got off. I haven't been on medications now since 2023. So
That's a pretty cool
almost
example
two and
of
a
how
half years.
powerful the breath is.
Yes, yes. And I take my blood pressure regularly. Every now and then it's a little high, but most of the time it is regulated just perfectly. My physician was um, amazed.
Yeah, I can
So I've
imagine.
actually got him kind of thinking about this thing. As a matter of fact, I'll share this with you. He called me. He went in his practice. He decided to go into a concierge practice where he could spend more time with patients and has less patients. And he called me while he was trying to decide to do it, and he was asking me questions. He said he didn't say I want to model my practice after yours, but he said I know that you're already doing this, and how's it working for you? And so it's great to be able to have the medical community start taking interest in this, because
Mm.
it's a powerful tool that they can use, with their patients. Because I think medical physicians that are really wanting their patients to get healthy are looking for alternatives than typical Western medicine has to offer. And so we're just all in this team together, Elsa and our practice, and thousands of others across the United States and the world that are looking for natural solutions and God given solutions that our body are already equipped to do to help maximize our health and give us the best chance of having a long, healthy, productive, and emotionally stable life. So, Elsa, I appreciate what you do, and I'm looking forward to continue to work with you.
Same. And I'm just going to add, that's what I hear from a lot of medical practitioners, is that when they learn about the breathing again from a different angle, they go back to their textbooks and like, oh, it's all there. So it's nothing like, it's
Yeah,
in their textbooks and they have read it. It just didn't like land because it was not a practical way of implementing it. So it's all
right.
in their textbooks. It's
Yeah.
nothing woo woo. It's there.
Yeah, yeah, it's not like some pie in the sky voodoo quackery thinking. This is all scientifically proven. There's been research after research after research, and I would say if you're into um, one of the first places that I would do, I would read James Nestor's book, Breathe, and I would uh, join the Weston Price Foundation because it's all in there and all the research is there. And this is can be life changing for you and your spouse, your family members, your kids. So do it. It's easy. It really doesn't cost anything other than if, having some sessions with Elsa or whatever breath coach, and after that you possess the power to do it and to regulate and to change your life however you want with and how breathing can help you with that. So until next time, Elsa, I will say goodbye. It's this is Dr. Hal Stewart with Elsa Unenge, Health and Harmony Beyond the Teeth. Thank you guys for listening, and we'll see you next time.